At this point, we're moving into the phase 4 shoulder exercises. In general, we're at a point where hopefully your range of motion is at least approaching normal or much improved from where it was a month ago. Most of the healing has occurred, though there is still some healing occurring, particularly if you had a large rotator cuff repair. But we want to start activating the muscles and working on some strengthening, but doing so in a more conservative fashion in a way that won't overstress any of the repairs you had done. This involves a lot of exercises which we call isometric exercises, and I'll let the therapist demonstrate that for you. So with that introduction, we'll move on to our physical therapist to demonstrate this for you.
For the next phase 4 exercises, we're going to start on the table in prone with the prone row. So she's going to move her arms slowly with the bent elbow into rowing position to her body level in neutral. Again, moving through a nice range of motion that is fairly pain-free. Then the next exercise is still in prone position on your stomach, and you are going to do a prone extension. So you're bringing the shoulder with the elbow straight back toward the body into a neutral position, again moving through pain-free range of motion. So the next set of exercises are going to be isometric strengthening exercises, and you'll start with doing just about a 50% resistance, and you are going to hold it for 5 to 10 seconds, and you can do these 5 to 10 reps. Then we'll move into extension. So you're going to turn all the way around, and you're going to lean up against the wall, and the same thing, kind of a 50% or sub-max resistance, pushing against, and again, not in a pain-free range. It should be a comfortable feeling. Then the next one will be shoulder abduction. So you're going to turn and face against the wall. And here you're pushing right up against the wall, trying to lift the arm away from the body. Again, a 50% or sub-max resistance. Then you can put the towel for adduction. Again, this is an isometric, and you're pulling inward toward the body, 50% or sub-max in a pain-free range and holding. Next position would be external rotation. So again, this position is you are trying to rotate or bring the arm outward, keeping the elbow into the body and pushing outward into a rotation away from the body and holding that into a sub-max, again, resistance in a pain-free range. And then we'll have internal rotation. You can move into a corner and again moving inward, keeping the elbow towards into your body and moving your hand inward toward the body into internal rotation. Submaximal resistance in a pain-free range.